Hello, Dr. Mulholland coming at you from New York. We are doing a live quantum demonstration. Live quantum demonstration in a very common contour area that bothers a lot of patients. The bat wing, that hanging tricep fat that compromises the blouse you might want to wear or the tank top. And many patients, they don't want a brachioplasty. They don't even want liposuction. They'd like a single treatment, contour improvement that's noticeable. We're going to do that today, okay? So we've got our young lady here who's donated her arm to medical science. We have marked out, zoom in, Carlos, if you can. Perfect. We marked out the area of fat. Put your hand back just like that. I'm going to put on a pair of gloves. Excellent. And so this is a sterile technique in a clean environment. Think removing a mole. You can use some prep, a couple of square towels, and a pair of gloves, but I don't put on the mask. It's not an intraoperative technique you need to do in the OR. You can have this in your OR as part of your facelift, in your body contouring, in your tummy tuck, in your liposuction cases. I'm showing the side office contouring technique, okay? Side office contouring technique. So once I've got on my gloves, for my sterile technique. I've marked out X marks the spot. I got my access port. I've done my pinch test. She pinched out at 6 centimeters, so we'll call this 200, we'll call it 300 pulses. 300 pulses. 150 at a deeper level at my thumb index because I'm traction and temping. So 150 here and then 150 there. We're done. 300 pulses, 280, 300 pulses. And so we need a clean environment, and so this is a bit of overkill. Now, you say, well, can I do this in my office, in the side office? Of course you can. You can do this all the time in the side office. We're doing it here at the Opus. I would never do this at a Sheraton or a Westin, but you can certainly do it at a Ritz-Carlton or your office. Okay, now, I wouldn't use a big thing like that. I would just use a green towel or a couple of blue towels, just to keep the actual tip of your quantum from getting contaminated. Okay? And so we also need a little antiseptic. And so we use a little sterile prep. In this case, I'm using clear chlorhexidine. I like clear chlorhexidine because it doesn't stain the tissue brown like betadine. And if you use pink chlorhexidine, it leaves a pink color, and they might think they have cellulitis. So I like clear chlorhexidine. I simply prep the area. The only pre-medication this patient might get would be Toradol, a non-steroidal anti-inflammatory, and I give 1 dose of an antibiotic, cefazolin, second-generation cephalosporin. If they're penallergic, 1 dose of clindamycin about an hour or two before, and that's it.